Hello, everyone. I'm Paula Bartholomew, and I'm always delighted that you've joined me for Hawthorn University's All About Alumni series. Today, we get to meet with our graduate, Dr. Vicki Steine, to hear about the work she's doing post-graduation. And in her presentation today, Vicki's going to address some information about mental health and nutrition education and how her Hawthorn education facilitated the work she's doing now. So Vicki's going to present for about 30 minutes, and then you'll all have an opportunity to ask her questions directly. I think it's a fabulous opportunity to have this one-on-one time and to be able to really interact with Vicki about, whether it was the time that she's in school or what she's doing afterwards and plans that are upcoming. So hello, Vicki, and welcome. I'm so glad that you're here.
Hi, Paula. Yeah, me too. I'm really excited to be here today. Thank you for having me.
You bet. It's my pleasure to have you and to introduce you. So I'll start with that. Vicki Steine is a graduate from Hawthorn's doctoral program and has a story to share revealing how her education influenced her social work she's doing now. So in this presentation, Dr. Vicki shares how she combines her skills as a social worker with her nutritional knowledge to educate her clients about the benefits of treating mental health and neurological issues with both diet and supplements. She combines traditional psychotherapy, nutrition education, and body work in her practice. And this provides her clients with a holistic approach to healing. Valuing both traditional and integrative medicine, Vicki is a passionate believer in and a teacher of the power of personal responsibility in health and wellness. What a beautiful way to practice, Vicki. Thank you so much for being here.
Thank you. I'm so glad to be here.
All right, I am going to start us off, and I think a good place to start is for you to share your personal story and how your experiences brought you to Hawthorn.
Sure. Okay, so I know most people end up in holistic nutrition or in the holistic integrative field because of a personal health issue that they have, but I actually kind of backed into it in a different way and then ended up having health issues that helped me later. So I was taking Tai Chi from a friend of mine. Well, he became a friend, and he was a raw foodist. And I had been a Weight Watcher. I had had some issues with my weight going up and down over the years, early on in my young adulthood. And so I felt like I really knew nutrition pretty well, and I really fought him on becoming a raw foodist. And after about 2 years, he really kind of wore me down, and I decided to. And the result was that I felt amazing. I had about a 2-week detox that was horrendous, just really fatigued and not feeling great. But when I broke out of that, I felt incredible. And so I started reading everything I could get my hands on about nutrition, because I had never really connected the dots that how I felt every day, what was my normal, was related to the food I was eating, especially considering that I thought I was a pretty healthy eater, which is what probably a lot of us hear from our clients. I know I do. And so at the time I had a master's in social work, and I had been practicing for years, and then went out of the field and was working at my family's business and was pretty unhappy and was looking for a way to move out, and decided that going into nutrition education was going to be the next step for me. And so I was going to take a break completely from social work and just get a degree in nutrition. And I did the research. I looked at all the schools in the country. I did want a doctorate program. There were not a lot to be had at the time. And Hawthorn just kept calling to me. I thought the curriculum was amazing. And at the time, Liz Lipsky was on faculty, and she called me and we spoke at length. And she convinced me to come to Hawthorn. And it was really where I wanted to be. And while I was there, as I started learning, what I realized was that I couldn't separate social work from nutrition, that actually the nutrition was a huge piece of what social work, as a psychotherapist, I don't do traditional social work, I do psychotherapy, but as a psychotherapist, I really was missing all those years I was treating people. I missed out on treating them holistically, that we were just treating the behavior, or we were just treating them with medication, and that this nutrition piece was really the foundational piece. So I got really excited when I realized that I didn't have to separate social work from nutrition, that I could actually use the nutrition as a part of my psychotherapy and actually enhance my treatment for with my clients. So I started at Hawthorn, and I was working full time, and I had 2 children that I was raising. They're grown-ups now, but at the time I was raising them. And after 5 years of being on raw food, I suddenly took a dive. My life had become very stressful at work, and I took a dive, and I ended up very depressed and actually suicidal. And literally one day could not get out of bed. I literally one day picked up the phone, called my parents and said, I'm not coming in today. And I hung up and I rolled back over and curled up in a ball. And my parents, as a result, wanted to put me in the hospital. My husband and I decided that was not what I needed to do. And I did go on medication. So I'm midstream in Hawthorn, learning all about how food is a way of healing the body. And here I was really in the depths of despair and on medication, the last thing I wanted to do. So I ended up ultimately, because of my training at Hawthorn, looking for an alternative doctor, which I found. She put me on supplements, and she had me go back to eating animal protein. And within 3 months, I was off the medication and I was back to myself. Right. So it was a huge lesson for me in terms of how food can truly impact your body. Deficiencies can really create mental health issues. And it's not the case all the time. I work with a lot of people who have neurological disorders who really do need medication. But I did learn that even as an adjunct therapy, nutrition is key to depression, and to anxiety and other, any of those other neurological disorders that I work with. And then following that depression, 2010 was not a good year. About 4 months later, I was on a business trip in Chicago, and I was in a boating accident. My cousin was driving a boat on Lake Michigan, and we hit a wall at 25 miles an hour. It was after the sun had set, and he didn't see the wall, and we drove right into it. And the boat had a huge hole in it. I had been sitting in front, and I went flying forward, and I hit the dashboard and broke all my ribs, and I collapsed both lungs, and I broke my neck. And I had to be carried off the boat on a backboard. I spent 3 weeks in the hospital, one week in ICU and 2 weeks in rehab, and then another 18 months in rehab. And so during that time, I actually had to drop out of Hawthorn for a short period of time because I was healing and I was on a lot of medication for pain and I couldn't concentrate. And Hawthorn was gracious and generous and supported me, and it was wonderful to have them in my corner. And during that time, Liz and I worked together on nutrition and on supplements because my doctor wanted me to be on Boost and I didn't want to be on Boost. And I came home and I continued my nutritional regimen along with some other I had a whole team that I worked with, integrative team. And I went to a pulmonologist when I came back to Atlanta. He took x-rays, and then 12 weeks later, he took another set of x-rays. And he said to me, if I had 100 pulmonologists in the room, no one would believe that your lungs are the same lungs I took a picture of 12 weeks ago. And I said to him, well, it's really just good nutrition. And he said, oh, well, whatever works. And he walked out of the room. He completely dismissed me, which I thought was so interesting. But I truly felt like my healing and it was a quick recovery, considering the amount of injury I had, was due to the nutrition and the other modalities that I used. I used energy medicine. I used massage. I did a bunch of different things, but I truly think that the nutrition was one of the cornerstones of my recovery. So I owe a lot to Hawthorn. I really enjoyed my education there. It was an amazing experience, and it helped me. It helped me really get better on a lot of different levels. And so now I use Hawthorn and the education that I got there to do what I do in my psychotherapy. So exactly what I got excited about is what I do. So I use nutrition even when I have clients who don't come to me for nutrition. They come to me because they're anxious or depressed, or they have Tourette's, or they have family issues, whatever it is. the first thing I do after I do a regular psychotherapy intake is typically my first session, and my second session is almost always nutrition. And I'll have people say to me, now, I came to you for depression. Why are we talking about food?
Yes.
So I get to do a lot of education, and as my reputation is growing, I'm now getting more and more people who are coming to me and saying, I heard that you do this, and I don't want to do medication, or I'm doing medication and it's not really working. Can you help me to add on and do some good nutrition? Because I know I keep reading all this stuff, and I know that I should probably be eating better, but I don't know what to do. And so I guide them. So it's really enhanced my practice.
Wow, it's a really good story. I knew most of this, but not all of it. And it's interesting because you took to raw food and felt so great. And it's not uncommon that somebody makes a dietary change, and eating so clean as raw can be suited you for a while, but then it sounded like it was very depleting for you, that you weren't able to keep up with what your body needs, and it may have been significant in contributing to the depression. Do you feel like that's possible?
Oh, I think that's absolutely 100% what happened. I think that I had so much stress that I was using up a lot of nutrients, and I just became very deficient. And there was just, I simply could not make the neurotransmitters that I needed to maintain good mental health. And so, yeah, I absolutely think it was the raw food. And I always tell people, you know what, it was great until it wasn't. For 5 years, I felt amazing, and then suddenly I didn't. It was not working for me. So, yeah, now I'm very religious about, I make sure I eat protein at every meal, and I don't mess around with that. and I'm clear with my clients. I mean, I'm very willing to share this story, and people always thank me for sharing it, because I think there's so many negatives around people thinking about killing themselves or being depressed or anxious. There's a stigma. And so I'm very open about this, because I think it helps people to hear that I was there, and I was able to change things, and that nutrition got me there in a big way, and it got me out also. So it helps my clients to hear that.
All right, and it's not an uncommon story in terms of life intervenes in some way for many of our students who are busy working adults, and circumstance comes up, and they need a break for some reason, and you've got Hawthorn here to support you. So I'm really glad to hear that the overall community was helpful and encouraging for you during that time, and that Liz was able to show up in a really significant way to guide you through the nutritional component too, as you get your legs back under you, so to speak.
Yeah, she was wonderful. She actually boxed up a bunch of supplements and shipped them to me. It was really very sweet.
Yeah, well, when you're in that kind of a need, you do what you can. Yeah. And we're going to have Liz is coming back for a Tuesday night webinar for us, May 16th, and the topic's obesity, awesome. Metabolic syndrome, and microbiome. So good thing. It'll be good to have Liz's voice back here at Hawthorn for a bit.
Yeah.
Okay. All right, well, let's talk a little bit more about your practice, if you're ready.
Yeah, I'm ready.
Talk about how you built up your practice and what you're doing now, and how you got to here.
Yeah, so I graduated from Hawthorn 3 years ago, and that was coinciding with my recovery, which was, I think I started my practice about 5 years ago. And people really didn't want to talk to me about the nutrition piece till I finished my education. So the education part of my practice didn't really start, I didn't start trying to build that until after I graduated. But I did a lot in networking before then. I went to a lot of meetings and met a lot of people, and it led me to these different places. So I actually work out of several different clinics. The one on the far left, Park Air Consultants, is the primary place that I work. I do mostly psychotherapy there. They brought me in to do nutrition, but when they learned that I was a licensed clinical social worker, they started sending me psychotherapy clients. And so I did that for the first few years, and now I do the combination of the nutrition. So I would say that I probably have a good quarter of my practice comes in for just nutrition now. And then the rest, like I said, I co-treat nutrition and psychotherapy. And the Mind in Motion is a developmental center in a suburb of Atlanta, north of Atlanta. And Dr. Dave Cantor helped me with my dissertation. He actually did all of the EEGs for my kids that I was researching. And so I've stayed on his staff and provide functional nutrition for him. And additionally, under Spectrum Integrative Health is a brand new practice that's in the same area as Mind in Motion. And there's an integrative doctor there. She was a ER doc, and she has some special needs kids. And so she has had to make some changes. And as you know, as they say, once you get out of the box, you can't get back in. So she has started an integrative practice, and she learned about me coincidentally through Park Air because her kids were here. And she asked me to come on board. So Mind in Motion actually refers to me only, and I see clients there, but then they also refer to Spectrum because then I have a doctor on site who can write lab work and order testing, because in the state of Georgia, I can't do any of that, but if I can do it under a doctor. So we work collaboratively, which has actually been fantastic because she's new to integrative medicine, so she's learning, and so we really work as a team, which is it's been fantastic. And then on Fridays I'm at Amen Clinic. They nutrition is a huge component of their treatment plan, and they have a couple psychiatrists on staff, and so they will refer to me. And so on Fridays I go there and I see people and I educate them about nutrition. And that one is probably pretty much straight nutrition. We don't do a lot of fancy stuff. We're not doing GAPS diets or carbohydrate diets or anything like that. They'll do it if I suggest it, but typically it's just straight nutrition education. So it's a combination of all these different places. I'm all over the place, and makes me a little bit crazy sometimes, but it's interesting and it's fun, and every day is different.
I bet every day is different. Absolutely. It's a challenge to juggle in between places, but it sounds like the colleagues that you get to interact with and the different kind of intel that you have really keeps it fresh. And sounds great. Yeah. Well, yeah, let's talk a little bit more about how being a licensed clinical social worker and nutrition educator fits and helps you serve your clients.
Yeah. So again, this is one of those underutilized parts of psychotherapy. It's so interesting. We're hearing more and more about mind body and mind body spirit, and we're doing a lot more mindfulness and meditation and trying to get people outside. But I feel like in conventional medicine, we're still missing the boat in a big way with nutrition. So as I said, I keep trying to bring this back to my patients and my clients. So I work a lot with ADHD. That's probably one of the biggest disorders that I work with. And just as this slide, I just kind of threw it in just to understand that 87% of children with ADHD have more than one disorder. So only 36% of kids or adults have just ADHD. The rest of them also have other issues like learning disabilities, or they have anxiety and depression. So they have a whole list of disorders that go with the ADHD. So when you start looking at, well, why is this going on and what's affecting them and how do we treat them? Again, when they come here for psychotherapy, they're coming and looking for just behavior. They're looking for behavior management. They're looking for something called cognitive behavior therapy. They're looking for occupational therapy and speech and language, all kinds of stuff. But I want to look at what's going on first, because it biologically and nutritionally, because if we try and treat a kid before we look at their nutrition, we're treating probably a lot more behaviors than we need to be. So if you look at this, for example, with this study of 2019s that had celiacs and 2019s who were the control, 31% of the teens with celiacs had depression versus the teens only 7%. So I get a kid in my office and I have had up to 10 years old, that young, talking about suicide. You get somebody who's really majorly depressed, and I'm going to start throwing cognitive behavioral therapy at them, when maybe if I just took them off of wheat and gluten, their mood would actually improve tremendously. There may still be some depression there, but it may not be at the level that they were experiencing it at. And so my treatment plan is going to change if they are actually better after we get them off of the wheat or the gluten. I had a woman come in here. This was an adult woman. She was terribly depressed. She came in, she was crying. Her marriage was falling apart. She couldn't stand her kids. She was just a mess. And I asked her what she was eating, and she was not really eating anything. So I had her, I gave her a plan. She started eating some, regular whole foods. I had her go to her doctor and have her check for hormones. I had her check for physical. She hadn't had sex with her husband in months. I said, go get your hormones checked. Let's make sure that that's not an issue. She came back the next week. She said, my husband wants to know why I've seen other therapists, and none of them ever had me do this stuff before. And I said, well, no, other therapists aren't trained like I am. So she went and she did all of it. And within 1 month, she came back. She said, my relationship with my husband is fine. My kids are fine. I don't know why I came here. I feel great. And I never saw her again. Right? So easy. So easy. I work myself a job all the time.
No, not really. You serve the client well. I have done a good amount of counseling in the past, and have a similar situation with couples that have come in, and I said, okay, well, first let's talk about what you're eating, and they're like, what? But they knew that had come to me that blended a number of modalities. And so once they addressed their diet, it was the same thing. It's like, we don't have relational issues. We don't have mood disorders anymore. We can skip that part of it and stick with our new diet and lifestyle plan. So brilliant. I'm really glad to hear your experience there.
It is funny. It's like, oh, I'm not irritable anymore. Okay, I get it. Mm-hmm. And so, and here's another example. IBS in schizophrenia, major depression, and in panic. So, how many psychotherapists are looking at, when they get somebody in with panic disorder, they're going to start treating them for PTSD and, all these other things. And if you just look at, oh, well, maybe if they have IBS and we can treat their gut first, we might be taking away some of these issues. So this is exciting to me because I can get people well. As you mentioned, I get people well quicker. And I won't say it's easy because a lot of times I get people who aren't compliant and who don't buy it. Who don't want to make the connection. They don't want to give up I have a mom right now, her kid's ADHD and has terrible migraines. So I took them off we did a gluten-free, casein-free diet as a first pass. And mom, I checked up on mom on Monday, and she said in an email, being dairy-free is just too restrictive. We just can't do it. So I get that too. I get that pushback sometimes, and it's, it frustrates me, but you have to start where the client is. And so I said, fine, I have other ideas. If you want help, I'm here. And if not, we'll just, whenever you're ready. And so it goes both ways, unfortunately.
And don't you find that if you introduce it as a trial, not something that you're going to be dairy free forever, but we're going to try this for X amount of time and see how you respond. It lightens it up a little bit for many people, that it's not an all or nothing and it's not forever. And once they have a direct experience of taking something better and putting it back in and feeling worse again, it's very telling. And then it's personal choice on their part. It's not just I don't want to change, it's too restrictive. But then they have to make a choice of do they want to feel better or not, knowing that.
Yeah, I do find that 2-week trial is a really nice way of getting people to at least give it a little attempt. And then sometimes, and sometimes a lot of times that does work. I had a client this afternoon, and she said this is the first time she's been coming in every week, and she comes with a list of questions. She's so cute. She writes down all these questions, and we just talk about her questions, and I'm just helping her transition slowly. And because I'm finding with ADHD, the people with ADHD have a whole separate issue, which is their impulsivity. And so even though their intentions are good and they want to do what we're talking about, they get very impulsive. Somebody puts something in front of them and they eat it before they realize that they've done it, and they get upset with themselves. And there's this whole cycle around their ADHD that happens. So I'm learning that with ADHD in particular, working really slower than normal, is the best way to go. So this client said to me that she is learning that this is not about willpower, but about empowering herself. which I absolutely loved. I just thought it was great. And I asked them,
really, really good awareness. And so you're working ADHD both with children and adults, it sounds like.
Yes. Yeah, I go as low as 8 years old and as high as people want to be in my office. Yeah. So, and then this slide on magnesium, same thing. As we know, magnesium is deficient in our diets, most people's diets. And here are some, I'm always just shocked by this slide with the issues. These are the things that show up in my office every day: short-term memory loss, emotional up and down, irrational fears, panic, anxiety, depression, easy anger. So such an easy fix to put somebody on a whole foods diet and a good multivitamin and a probiotic and get them feeling better fairly quickly. And then, of course, I always talk about leaky gut, and particularly with the ADHD population and the autistic population, and especially when I'm teaching them about going gluten-free, and it's such a challenge, and for so many moms, it's very overwhelming to even think about being gluten-free in their homes. I find that the more education they have, the more they really understand how their bodies or their children's bodies are working, the more compliance I get. So I do like to talk about leaky gut and explain exactly what it is, and that it is a real thing, and that this might be part of what's going on with them. And so, I usually find people are pretty appreciative of getting that additional education.
Sure.
So this is part of how I use nutrition and integrate it in the practice.
I'd like to go into a little bit more depth. So I'm glad to see this and talk about how you integrate nutrition in a psychotherapy session.
Yeah. So when I get somebody in, what I will typically do, as I mentioned before, is I'll do just a psychotherapy intake. And then the second session, I will do a very basic nutrition intake. Like I'll ask them, like a basic food diary. I'll just ask them, recall, just self-report recall. What did you have for breakfast? What do you typically eat? And I'll just kind of get an outline. And if I feel like I can really hook them, then I will give them the nutritional intake and I'll go more in depth. If I don't have a hook right then I just keep weaving the nutrition in. Like if they come in and they come in and just complain that they've had a really bad week, I'm going to ask them, actually, I really take a holistic approach, because I ask them about their sleep, I ask them about their nutrition, I ask them about their exercise, how much time they're spending on electronics, and how much time they're spending in the sun. And try and get them to keep thinking in terms of all of those pieces in their mental health. But if I get somebody who's just wanting nutrition education, then I start with this. And I've got two forms. I have one for adults and one for kids. It's a combined effort of a lot of different clinicians who were kind enough to share their intake forms with me. And I took the best of all of it and put it together for what was going to work best for me. And so this form is about 19 pages. It's a lot of space filled, left for filling in. But I get a really good picture of what's going on with the kid. This is a really nice, functional intake because it looks at their whole history. It looks at what symptoms they've got. It does look at sleep. It looks at some of their connections with other kids, how much time they play. And I get a good history of the kids' general health from birth until whatever time I'm seeing them. So I love getting this before. I always ask to have it in hand before I see them. So I read it before they come in, and I make a lot of notes, get some ideas about what direction that I'm thinking we should go. And then I'll interview the parents. I won't interview kids unless they are either super into it when they're young, like if they're really precocious. Otherwise, like from 8 to 11, they get very restless and bored in the sessions and they don't really want to pay attention. But if I have a young teen and up, I want them in there because they make choices for themselves. They go to friends' houses, they make choices at school, and I want to start educating them on what they're eating so that when they're away from mom, because it's one thing to control what's in their kitchen at home, but I want these kids to really learn what they need to be doing for themselves and making good decisions for themselves when they're outside of their mom's house, mom and dad's house. So I do like to have the kids in the session. And then I'll usually meet with people and follow up with them. The first follow-up I usually try to do within 2 weeks. Sometimes they feel really anxious and they want to come back 1 week later. I find I don't want to go out more than 2 weeks, but I do like to give them time to implement some things and see how they're feeling. I leave myself open to emails anytime. No one ever abuses it. I just say, you can email me free of charge whenever you want if you have a question. And I will get some, but usually people are very respectful and keep their boundaries, which is nice. So I've never had to say to somebody, let's talk about this in the office. And then I will continue to meet with them and push the meetings out further and further as they get more confident. And then eventually we might just have like a monthly meeting or a 6-week check-in. And then after a while, we'll decide that they're doing well and they move on. So that's how I integrate it.
All right. Well, you've talked a little bit here and given us a good picture of what happens inside the office. Are there other things that you want to add there, or do you want to talk more about what you're doing additionally outside the office?
I think I'd like to talk about what I'm doing outside the office.
Okay.
So this slide just gives an idea of some of the talks that I've done. And part of building a practice, I think, is really putting yourself out in the community as much as possible. So I usually don't say no. In fact, I don't think I've ever said no when somebody asks me to come speak. So sometimes I seek them out. Sometimes I've been fortunate and people have actually, through my networking, have asked me to speak. And these are just a few of the places that I've spoken. I have, part of my mission is to really educate people about nutrition. So if I can get to all these different organizations and introduce parents in particular to what they can be doing for their children, then I feel like I am meeting my mission. So I was fortunate to know somebody at Whole Foods. She was part of the outreach program, and so she brought me in a year ago, and I think I did 3 or 4 talks there. So that was nice because that was just in the community and at the store. Foundations Treatment Center is actually an alcohol and drug rehab outpatient facility here in town. And I actually did a 6-hour training that day. It was a Friday afternoon for professionals. So that was actually, and yes, I did that for free. But I have worked in addiction and we never talked about food. And so I really felt like to really reach some of these professionals in the addiction community, it was really important for me to try and get that message out to them. And then these are just some of the others. The Southeastern Biofeedback Conference I went to because Dr. Cantor had helped me with my dissertation, and he wanted to present and asked me to co-present with him there on our findings. And then these other conferences were all in Atlanta, and I knew people who were kind enough to invite me. The Institute for Challenging Disorganization teleclass was actually just last week. These are folks that work with people who are hoarders, and it's a huge profession for teaching people how to get their homes clean. They're a large population of OCD also, and so they asked me to speak about focus and how to eat nutrition, how to nutritionally handle focus, what they could do for their patients. So that was kind of an interesting twist on what I was speaking about. It was fun. It was a fun talk.
And it sounds great. And this last one, the keynote speaker, what was the annual conference and what were you addressing?
So Focus, I'm glad you asked that because I missed that. Focus is actually a special needs organization here in town. Actually, I think it might even be larger than just, it might be a national organization. I'm not quite sure. I went on their website the other day just to check them out, and they've actually combined with another organization. But they work with special needs, and these are these are like really autistic, severely autistic special needs kids. And they had me come and do a talk, and I did just it was just like a Saturday morning. They did a lunch and learn kind of thing for a bunch of parents. And I was one of many speakers that morning. And then apparently they liked my speaking at that one engagement and invited me to come back as the keynote for their annual conference, which I did. So again, I spoke about nutrition and how to treat their kids. I talked a lot about inflammation and gut health, that kind of thing.
Okay, great. No, you're getting known, and people are recognizing the difference information that you can bring in your skill set. So Bravo here. Really nicely done. Well, I think you're in Georgia, right?
Yes.
So how's Georgia treating you for doing this kind of work,
So,
combining nutrition and your psychotherapy?
yeah.
Oh, there you
So
go.
Georgia's a
You're
tough
ready
place.
for that question, aren't you?
So Georgia's a tough place to work, and and part of it, unfortunately, as we all know, Hawthorn is not accredited, and I chose to come to Hawthorn in spite of that because I so believed in the curriculum. But in 1984, the dietitians passed a very tight law about who can practice nutrition in the state of Georgia, and you have to be from an accredited school, or you have to be an MD or an OD or a chiropractor. They list a bunch of different professions. Social workers, unfortunately, are not listed in that profession. So unbeknownst to me, I didn't know any of this when I first started, and I had on my website that I did nutrition counseling because I am a counselor. But I had somebody report me, and so the Secretary of State did ask me to cease and desist my wording on my webpage. So it was very specific. So I changed my website so that now I am very clear. I'm a nutrition educator. Anytime that anybody calls me a nutritionist, I correct them immediately. I make sure there's nothing in writing that has that in anything out there with my name attached to it. And because I'm an LCSW, I did report to my board what had happened. And basically my board said, as long as I was properly trained, which they felt clearly I was, that I could practice what I need to practice appropriately under my license. So I am very careful, even though I do treat people with nutrition issues and they come in specifically for nutrition, it's because they have anxiety or because they have ADHD that they really are trying to get the treatment. It's not, I don't do weight loss programs. We might end up losing weight in our process, but that's not what we are primarily doing. So I really try and stay within my scope of practice because of my license. And just as a side, one of our other graduates, Sheila Dean, did start an academy, the Integrative Functional Nutrition Academy last year, and it is accredited. So I did take that class, and I'm going to take her test and get her certifications simply as another piece of arsenal in my closet so that I can say I have something from an accredited school. Because I still feel nervous about it, but I've been very upfront with all the clinics I work with, and none of them care, and none of my clients care. And I have a big disclaimer that I have people sign, and they're all fine with it. So as long as I stay within my scope of practice, I feel like I'm okay.
Well, you've really done very good legwork around this. You've done investigation of what's right. You've reached out to your board. You adapted things on your website to indicate that you're doing nutrition education, so it's not an issue from the registered dietitian's perspective, and then getting the certification through Sheila Dean is really helpful. So I think you've put a lot of so-called ducks in the row here to protect yourself and to continue to be able to do the brilliant work that you're doing, really making a difference in the mental health field. It's so very important to bring this piece of nutrition into it. It's a huge missing piece. It's getting a lot of people obviously into mental health stress that can easily be remedied. Easy is a relative term here, but by contrast to everything being done with medications, I'm just so pleased. Yeah, really pleased to see the work you're doing.
Thank you.
Well, why don't we wrap up this with talk about what some of your future goals are?
Yeah, so I have recently, I'm very excited about this. I recently was asked by a company called Vine Education to be a speaker in their arsenal of speakers. They, I don't know how many people get these kinds of flyers. I get tons of them every day. There are several organizations around the country that provide speaking CEUs for professionals, and they contacted me. They actually saw my bio on the Amen website, and they were excited because she said that they were looking for someone to do integrative and mental health, integrative functional nutrition and mental health, and they were able to find nutritionists and they were able to find therapists, but they couldn't find someone who had both degrees. So she was thrilled to find me and asked me if I would be interested in doing this. And this is really one of my dreams, to really reach out to other psychotherapists, psychologists, psychiatrists, and help them understand how important this piece is to our treatment plans. Because like I said, I worked in addiction for 12, I don't know, 15 years, whatever it was, and we never ever talked about this. And I worked in an inpatient unit, I worked in outpatient units, and we never talked about food. And these, especially, recovering addicts, they're coming off of all kinds of opiates and other drugs, they're craving sugar, they don't eat right, they're deficient in a million different things, and we're not addressing it. So, right. And then we're surprised when they relapse. So I'm very excited. So I said yes. So I will be traveling starting in September twice a month, 3 days of the week, to 3 different cities that are within driving distance of each other, and speaking to my professional groups about nutrition and mental health.
Oh, I'm just thrilled. I am so thrilled for this opportunity for you and for Georgia.
Yeah, I'm very excited. Well, it's going to be national. I will be traveling all over the country. So that's really exciting. And then I
want you to keep in touch with us and what your schedule is, and if any Hawthorn students or graduates are in cities, locations where you're going to be presenting, maybe they'd put you up. So you could stay in a house, not a hotel, and just generate some support that way too of the people coming to your talks.
That's a great idea. I will definitely do that. I love that. I will let you know.
Okay.
And then I want to, somewhere along the line, I do want to write a book about my story. And I do, but I really, really want to write a series of children's books, because I use books with kids, and actually sometimes I use children's books with adults, because the pictures and the stories help to get my point across, about nutrition and mental health and ADHD and all the things that I do, because there's really nothing out there. Yes. And I want the kids to buy in. I want them to understand how important it is to what their brain is doing or not doing. Right. They know that sugar might make them hyper, but they don't know that if they don't eat certain foods that they're not going to get better as fast, or they'll never feel optimally better. So I really want to have a reading series, and I actually started it at Hawthorn. It was one of my last projects. I just thought I couldn't write another term paper. I just couldn't do it. So we were given the option of some creative things, and I thought, I'm going to write a children's book. And so I did, and I have edited it twice, and I hired an illustrator. I've gotten to a certain point where I was going to do it, and then I got busy with work, and I've had to put it aside. But it's really, it's finally, as things are settling down in my work life, it's going to bubble up to the top, I think, and I'm going to really try and get it done over the summer, at least the first of the summer.
Oh, fantastic. Yeah, stay in touch with us about this too. And I want to let people know what your website is, since that you don't have that on one of your slides. It's yourhealthystructure.com.
Right.
To find out more and to keep track of Dr. Vicki Steine here. Any closing thoughts here?
No, I think we covered pretty much everything. So I really appreciate the opportunity to talk here.
It's been my pleasure, really, to have you. I hope you'll visit us again at Hawthorn and continue to provide and share your good work. So yeah, we want to keep track of this for certain. You're a rising star, and I'm proud of you, and I'm just thrilled with the work that you're doing, and I'm so grateful that you took time out of your increasingly busy schedule to spend some of it with us and share this important thoughts and ideas and work. So really glad to have you. It was wonderful. So thank you for that, and for all of you for joining us in this All About Alumni. I want to help spread the word for our next All About Alumni. We'll meet back here on May 3rd with Julia Visser, who graduated from our Master of Science in Holistic Nutrition program, and she's going to talk about some of the work she's been doing in nutrition with sports. So more on that later, and we'll have a survey to fill out after this webinar ends, so I hope you take a couple minutes to fill that out. We really appreciate it. And we recorded this, so if you want to hear any of it again or have anybody visit Hawthorn's website, it'll be posted in just a couple days. It can be found under archived webinars. And yeah, this is a good story for other people to hear about. There is hope in the mental health field. Thanks again, Vicki.
Thank you.
Bye, everybody.